Okay, Dad.
Hi, honey.
How are you?
Getting by.
Yeah?
Yeah.
Okay, you want to tell everybody why we're here today? This is Mom's phone.
We're going to talk about vaccination, immunization, and what's happening for COVID, and what's being offered to the public.
Okay, where do you want to start? Can you just give us the basic rundown? I feel like I know little about what's actually happening, and I kind of wanted to wait to have that conversation with you.
Okay, well, it's a huge topic on how the population becomes immune to something versus how an individual becomes immune to something, because that sets up a series of different dialogues, if you will, both with public health and with your own physician, that may be confusing. And clearly the whole COVID topic, from the politics of a disease to the actual medical issues involved, has been one that's been sourced as confusion for the general public rather than clarification.
Definitely.
I think if we start with a couple of definitions, it might help. Because, like I said, it's a topic that is not straightforward or, if you will, easy to comprehend in just simple sentences.
Right.
I think we have to keep it. We have to keep it basic language and simplicity rather than, all the code words.
Right.
To start with, let's look at what is herd immunity, because that's functionally the goal of a vaccine program. And herd immunity is acquired either through natural infection in enough of the vulnerable population or through the exposure to material that gives the same sort of immune response in the individual, so that they are protected without the disease being the issue that gave them that protection. The immune system responds to foreign material. That's what it's been programmed to do for however many millions of years we've been on the planet. And by the same token, for however many millions of years so existed the agents, the foreign agents, the things that infected us or impacted in our lives. And what we're now doing is trying to cure, in effect, the common cold. And to date, most efforts that have been made in that direction relative to a vaccine have not been successful, and there are several embedded reasons for that. But the virus that actually, the coronavirus, that actually is linked back to this form of cold. There are other viruses that cause colds. But the coronavirus that we're dealing with has sort of a nasty habit of picking up stray bits of RNA or genetic information in its passage, not only through people, but through animals. And it translates from one type of infection to a different type of infection if we speak about pathophysiology. That is a code word, meaning the actual viral mechanics of how an infection occurs and whether or not the infection has lethal consequences or not.
Can you explain, so you're specifically talking about COVID-19 right now, right?
Well, I'm referring to general viruses, but specifically we're going to talk about the viral vaccine for COVID. I think that's our agenda tonight.
When you say RNA virus and picking up RNA bits and pieces along the way, is that what COVID-19 is? Is it an RNA virus? And can you explain the different types of viruses and how, just explain that,
In a broader definition of viral disorders, the category of a virus containing either DNA, most people know what DNA is, desoxyribonucleic acid, versus RNA, which is a component, ribonucleic acid rather than desoxy. The genetic material that is owned by a species of virus and distinguishes one versus another generally tends to be either one type of DNA versus, rather one type of nucleic acid, DNA, versus another type, RNA. And just as an example, DNA virus would be an orthopox virus, the virus responsible, for example, for smallpox.
Okay.
Coronavirus is an RNA virus, and there are multiple different types of RNA viruses. Include polio in that, include several of the agents that cause diarrheas and the things that plague us that are, generally speaking, not lethal.
So the idea that coronavirus is an RNA virus, so what does that have to do with? That has to do with how we understand the structure of the virus itself, correct?
That's the virus's genetic material, is
Okay.
RNA composition.
Okay.
Okay?
Okay.
So the vaccine has to address an RNA process.
Okay.
So it's an RNA viral vaccine as opposed to a DNA viral vaccine.
Right, which I kind of remember us talking last time, and you said that DNA viruses are much more complex because there's more genetic material. Is that how it works?
And they structurally are different.
Okay.
The type of RNA, and there are multiple different layers now, or types of RNA, that is contained in the virus, determine how the virus, once it's entered into the infectious cycle, which requires the virus to get inside a cell, take over a cell, replicate itself, and then exit the cell so it can go on and infect something else.
Right.
All of those things are encoded in a different kind of an RNA. DNA viruses tend to be more structurally complex, but they do the same thing.
Okay.
I mean, they're not freestanding organisms that can survive without infecting a host that's susceptible.
Right.
Okay.
Right. And
all viruses, whether they're DNA or RNA viruses, are obligate parasites. They cannot exist on their own.
Right.
They do not exist on their own.
Right.
They don't have organs of circulation or respiration or the elements reproduction that enable life to continue and to survive. So the virus, by its nature, the parasitic nature of this thing, has to find a host that will accept the virus internally. So they have to have a mechanism of invasion.
Right.
And once they've invaded, they then have to have a mechanism to take over the cellular mechanics inside that cell.
Right.
To turn that cell into a manufacturer of more viral particles.
Right.
In the process of doing that, they generally tend to kill the cell, but not always.
Okay.
And that's an important aspect of, say, viral lifestyle.
Okay.
And as the virus and the host have more and more contact with each other, each develops kind of each evolves into an entity that either balances, and thus the host will survive, or if the host always perishes, so too will the virus.
Right.
So you've got to have, an attenuation of viral virulence, of pathology, of its ability to not just infect but to kill. If the virus itself doesn't eventually kind of ratchet back that lethal outcome, the virus will perish as well. It's called attenuation.
Relationship.
Yep.
So essentially, a virus's goal isn't to kill; it's really just to spread.
It's to propagate, right?
Yeah.
So, if anything, viruses are reproductively active, and that's it. They really don't. There's no other process going on.
Like anything else in life, it's just spreading the seed.
Yep.
So, okay.
That's how they survive.
So you talk about attenuation, right? That's something that you have told me before in the past about how now we're seeing that the virus is, quote, attenuating in our population. because I don't know if you finished your points on herd immunity, but if you have more to say about that, that's obviously important as well. So can you talk a little bit about the attenuation, and if you have to say more about herd immunity?
Let's go back to herd immunity, because that's more important than attenuation. Herd immunity occurs when enough of the population has developed a defense.
Okay.
If we looked at smallpox, the percentage of the population, if you will, that had to be rendered immune before the disease came under control was roughly on the order of 70% of the whole population, maybe a little bit higher. The most infectious disease, like chickenpox or measles, you have to get to 90% of the population having some form of immunity before the infection literally burns out. It doesn't find a victim.
Interesting.
So herd immunity has to do with the percent of the population that's resistant. And once that population becomes resistant, they don't pass the infection on to somebody else.
Right.
And they themselves are protected. Herd immunity, though, as a biological reality, means that enough of the population is not going to be infected by the virus.
Okay.
And the people who haven't had the virus and who haven't been vaccinated are somehow likely not to get it either. So it kind of puts a threshold on what the virus can do when you talk about the whole population. The goal of a public health process and policy is to protect the uninfected. In other words, the process of a vaccine program is to protect those who are not yet infected or who may be susceptible even though they've been infected, to prevent them from getting the disease or spreading the disease. So you have all of these different considerations, but all of that goes into how you judge the effectiveness of a vaccine.
Interesting. So, okay. So now the next step of the actual vaccine. So where does it go from here?
Well, the vaccines that have been developed, and they are the legacy of many, many years of developing vaccines. The knowledge that came from making a polio vaccine out of an attenuated strain of polio virus enabled the population to move away from seeing polio each year. It came in like a flu season, just as smallpox did, just as some of the more notorious infections of our ancestors, which represent, but rather how can we become protected against the COVID-19, and see sort of this level or threshold of immunity in all of the population. The goal of the current vaccine program is to create herd immunity without creating infection. The viral vaccine was developed against the mechanism that has been detected on how the coronavirus will penetrate the cell. So it's against for want of a better term, the spicules that hang out on the outside of the coronavirus.
Okay.
And
what is that?
The enzyme that gets, or the agency that gets that virus from the external, meaning in this case, say bloodstream or air supply, past the barriers that the body's immune system sets up and infects the cell. And apparently that resides in this outer layer, which gives the coronavirus its name.
The crown, right?
Right, but it's really around the whole very tiny morsel. The coronavirus itself is extremely, extremely small.
Yeah, you had mentioned.
You know, 1/1000th to 1/5000th of the diameter of a human hair. And it's not merely spread through droplets, which is also, it's spread through aerosolization. We breathe it out basically to have it. And you breathe it out, according to a study that was done in England, for about a week after the most aggressive symptoms of COVID-19 appear. After that, it doesn't appear to be very infectious. In other words, the virus itself doesn't survive for very long beyond that first week. So the person even that's had coronavirus has a period of vulnerability, of spread rather, that goes for about a week to 2 weeks.
Oh, interesting.
So the notions that people have developed on what is coronavirus and what do we have to do and have to sit 6 feet away and stuff like that, those are for spread. We wear the mask so we don't spread it,
right,
but it won't stop you from catching it.
Even if you're wearing a mask?
Even if you're wearing a mask, especially the cloth mask, that the size of that virus goes right through it, so you can get it, but you're going to cut down on the amount of spread.
So essentially, the whole point of the mask, which you've said this to me from the beginning, is it's really as a preventative for someone who has the virus to prevent other people from getting it.
Yeah.
Yeah.
And that's basically what the viral vaccine is supposed to do too. It cuts down on the amount of virus that can get into a cell and cuts down on the amount that you're spreading. But the irony is, we still don't know if it protects the individual. There's still a question on how immune you are rendered by this vaccine and how long that immunity will last. What we do know, step back a second. Why do we get a flu vaccine each year? How come we can't, like polio or measles or chickenpox or any of the other, why can't we get one vaccine and be done with it? It's because the virus changes. And we talked about viral attenuation, but there's a whole process going on all the time. And the virus dynamics are such that the length of time that you remain protected, even if you're vaccinated, is still to be determined.
Interesting.
But knowing that, most of the studies that have, if you will, compared a placebo, which is not an active drug, but compared placebo to active vaccine, have shown 95% effectiveness. One study, for example, on the Pfizer vaccine of 22,000 people roughly who got active vaccine and 22,000 people who were matched age-wise and exposure-wise, that the difference was in the vaccinated group of that 20,000+ number, only 5 cases occurred.
Oh my God.
But in the unvaccinated group, 172 or 175 roughly got infected. That difference shows effectiveness, and the safety of the vaccine is pretty much like any other vaccine. You'll be sore, you might have an immune response, which gives you some fever and joint aches and muscle aches. You feel like you're coming down with something, but that's really that the immune system itself is just going into an alert mode and is going to protect you by producing antibody. And the antibodies, as well as the lymphocytes, the cells that protect us in the white blood count of our immune system, are ramping up. And when that happens, you don't feel good. It's called malaise, but in the case of a vaccine, everybody says, oh, it made me sick. That's the perception.
But the reality is it's your immune system working for you.
And it
right?
also indicates that you didn't have very much immunity in the first get-go. So it tells you that the stuff is actually doing something.
Because I know there have been years where I've gotten a flu shot and I felt like crap for a day. Not really sick, maybe a slight fever. But then there's other times, like this year, I didn't feel anything.
Right.
I felt totally fine and strong. In fact, I forgot I even got the shot.
Yeah.
So that.
And if you get a good shot, that's what you should do.
Yes, that's right, Dad.
Okay,
it's a testament to you of being the best shot giver ever.
No, thanks. Not looking for compliment.
But okay, so this is interesting. So many questions because and I would imagine that a lot of people out there watching who aren't doctors and haven't studied this stuff, I still don't really understand how a vaccine works. I still maybe, I know that I could do more research on my end, but can you essentially explain because there's so many people who think, oh, viral vaccine means, oh, I'm just getting the actual virus in me. Yeah. How does it work? That's
good point. The most important thing about the COVID-19 vaccine is it's not a live viral vaccine.
Okay.
And it's derived through nanotechnology, which is fairly new, and is only an RNA verisimilitude. It looks like the RNA that came from a COVID-19, but it's not. So you're not going to get infected by it. That's important. But let's look at how the immune system programs itself and see how that template will fit into how does a viral vaccine work.
What are you actually being injected with? That's my question.
The viral vaccine has what's called an antigenic similarity to what the COVID is.
Okay.
And it's part of what the COVID is, not COVID-19, not the whole deal. So it's not live viral vaccine. It's a part of the genetic mix that will give the human immune system an ability to create an antibody against it, so it stops it from penetrating, among other things, and decreases its infectivity, so it stops infecting. In other words, you're still going to have contact with it, but you probably won't get sick. And there's also other elements. Certain types of lymphocytes or white blood cells are pulled up by this vaccine, and if they come in contact with the COVID, they'll also kill it. The null cells and K cells and T cells. It gets very complex, but the important thing is if you look at the network response of the immune system, and that's what the immune system is, a network.
Correct.
And it is embedded in our genetics. Our DNA predict that we're going to have a certain amount of white blood cells. Those white blood cells have, every single one of them have your full DNA complement. Well, if we look at the universe, you're different from, you have your own unique universe, and along will come this foreign protein, whatever it came from, whether it's a virus, a bacteria, dust mites in your house, or your dog's skin. Whatever it is, it's not you.
Right.
And the only signal the immune system needs to provide an immune response is to be triggered. It's triggered by taking the DNA, the RNA, or whatever came from outside of itself and comparing it to its DNA. And if that DNA cannot make this material that's been identified as foreign, it makes then, and the immune system will make then an antibody against the invader. It also does other things. It ramps up a cellular response. Like I said before, this can get very complicated, but let's just say, for purposes of discussion, we have a programmable computer that takes in this foreign material. If it's me, no response. If it's the same as self, there's not a X. Let's get rid of this non-self protein, and the system goes back to rest. But if it is foreign, if it's recognized as not being acceptably normal by my DNA code, I will start making a response. And depending on the burden, depending on how much of this and the comportment of the material that's come in the case of an infecting agent, it's not just passive. It didn't just find its way into your nose or throat or into a wound or whatever.
Right.
It now is invading. As soon as that happens, another series of responses are triggered.
Okay.
And when we're looking at how a viral vaccine would work, it takes all of that and loses the infectability, but gives the signal so your own immune system starts assembling the antibodies necessary and the cellular component necessary to stop the invader.
Wow.
So what we're really doing is, in effect, a very active process that starts with this notion that the system is in fact programmable. The people who are susceptible, the ones who have had problems, the elderly, the immunocompromised, the patients that have other drugs in their system, they've done something to change the way their immune system works. So it can't be programmed very well. They are the ones at risk. If you're afraid of COVID, get the vaccine when it's available. There's no question about a vaccine being safer than a disease. That, in effect, is the first test. Safety that has to be provided for the vaccine, and then efficacy, or the effectiveness of the vaccine. It has to have an immune response. There are still uncertainties. There's still things that haven't been data driven. For example, can you give it safely to a woman who's lactating or nursing or who's pregnant? Can you give it to a child under age 16? Those have not been studied or tested. So there are open areas for discussion. But in general, there isn't a vaccine program that isn't safer than the primary problem. The disease versus the vaccine is no contest. There should be no controversy and no questions. That doesn't mean you go out and stick your arm out for every vaccine,
right,
any more than you get the vaccine and you think you're bulletproof. Right. You're not going to be.
Very good point. So, like, can you? A lot of people and a lot of parents now, it's like whether there's truth to it or not getting vaccines, getting vaccines. I mean, that also in context of coronavirus. So can you talk about like both of those things?
Yeah, that's a couple of different topics in there.
I know.
Anti-vaccination has existed for a long time, and if the term vaccination comes from vaccinia. Vaccinia is cowpox. Do you know the story there?
No.
All right.
Please tell us.
Well, we'll go back to the late 17th century when a guy named Jenner was experimenting with, actually made an observation. And the observation was that milkmaids who were around cows all the time would pick up cowpox. It was a problem for them, and cowpox did make you feel kind of crummy. But what he noticed was that people that had cowpox never got smallpox, and smallpox was an incredibly deadly disease, endosforming, and it did a whole bunch of other things. Well, what he did was he took the pus from a cow's udder, where the cowpox would reside, and gave it to a subject, actually an orphan boy, as I remember, and he vaccinated him by scratching the skin and putting the scab literally into that wound. The kid developed vaccine, and then he did something which is incredible in today's both ethical climate and medical climate. He actually tried to infect him with smallpox, and he didn't get it.
Wow. So
in that regard, vaccination, which is derived from vaccinia, became a thing to do. There were other ways that people tried to avoid smallpox, and they did some incredible stuff. But what they knew has been the legacy from which we derive our notion that you can give something similar to, that's not identical with, the infecting agent, and develop adequate enough immunity that you don't have to, that you gain herd immunity. So really the goal of a vaccine program is to protect the healthy well by vaccinating the percent needed to stop the disease. As it comes out, COVID-19, you got to get to about 60% of the population as protected or surviving, and the disease will burn itself out.
Interesting.
So that's what we're looking to do. Now that's been the case with multiple attempts across the globe to control things like polio. It definitely worked with smallpox. Smallpox is a special case because smallpox only infects humankind. It is not found in any other animal. Right. Whereas COVID-19, dogs and cats and several other domestics, they can get it too and spread it too, apparently, though even that information is somewhat controversial. The susceptibility is different from the infectability, and people who have been infected can still be reinfected, apparently.
That's a question I have for you.
Okay.
Yeah. So
yeah.
So that is the thing.
Yeah, and it has, that's one of the reasons why they're not only doing 2 vaccines, but they're going to continue to monitor it. And it's now apparent that with that type of RNA virus, it's likely we're going to have to be re-vaccinated on a yearly basis, which is why we do it with flu. It keeps changing.
Would it be 2 vaccines a year or just 1?
I don't know.
Yeah.
I don't think they've worked that part of the issue out just yet. But
so just to clarify, so the vaccine is a viral vaccine, but it's not a live viral vaccine.
Right.
What is a live viral vaccine?
Polio vaccine.
So,
they attenuate the virus. It's done by doing what's called serialization, where you infect more than one critter, and then finally you get a weakened virus, and you can make a live viral vaccine.
But what does that mean exactly? Live, meaning you're actually being injected with the virus.
You're injected with a version of the virus that is not as lethal.
Interesting.
So they had a vaccine program, the Soviets did, that enabled a live viral vaccine that they could inhale. And what they do is they take a bunch of soldiers or a bunch of the military would go in and watch a movie, and they'd put it into the ventilation system, and everybody 15 to 30 minutes after they walked out of the theater would have an immune response to a live viral immune response. We did killed vaccine for polio at the beginning, which Jonas Salk put together, and it wasn't until several years later that Sabin came out with his live viral vaccine. And because it is a live virus, the enduring part of that vaccination is the legacy. So you can get one polio vaccine and you're sort of immune for life. There may be boosters for other reasons, but you don't need to keep getting polio vaccinated. You do need to keep getting flu vaccinated.
Right.
You do need several types of approaches depending on the disease, how the disease works, how it survives, and how it propagates.
That's crazy. It sounds extremely complicated.
It requires a good course in virology, and we had, as a society, the opportunity to learn how a virus works and what a virus does, instead of just scaring everybody at the beginning of this. But I'm back on my hobby horse now.
Okay, so it's a viral vaccine, not live.
No.
And essentially it works by injecting a code, not the same RNA code, but a different kind of
Modified.
Created in a lab kind of code, or is it from the actual virus itself?
No, I think I don't know how they're manufacturing
it,
or what process they use, but the RNA in the viral vaccine will alert the human immune system that a similar type of RNA has come into the system, and the system will be ready to defend itself.
So then it gives you the antibodies. So then can we talk about what happens then if you are reinfected, but you have then the vaccine? Because that's the next step of this, right? Is the seeing how effective it is, right?
So, and part of the studies that are being performed is to find out what type of antibodies the human being who's been vaccinated is making. And they compare that with the survivors of actual COVID-19 to see what the immune language is that's providing evidence for the contact with COVID-19. What is not totally clear yet is how long that antibody will be around and how well it protects the individual. But that's not the goal.
Yeah.
The goal of a vaccine program is to protect people who have not yet had contact. So the studies that are being done are not whether or not the person who got vaccinated is cured or made stronger or better. They can still be infected. But will the infection be spreadable?
Interesting.
So that aspect of a vaccine program is the important one for the public health community. They want to make sure that the individual doesn't carry away enough of the virus that's active and viable and infects the next person that they contact or their family or whatever. So it's really more like a rabies vaccine program where the dog or the cat can still get rabies, but they can't spread it.
So I could see how people would be like, well, if this isn't going to protect me, why would I get it?
That's sort of a basis for the anti-vaccinationists. But unless we all accept the fact that we will get it, unless we have that 60+% protection level in the population, then the disease will it'll just
and that's why we
fall away.
That's why we don't have things like measles and mumps and rubella, right? Anymore?
We don't, but if a specific population says, no, we're not going to get vaccinated, then all of a sudden you start hearing about these sort of small outbreaks, though they're not small inside that community, but people get, chickenpox, they get measles, they get mumps, and they haven't gone away. Those diseases still exist, but the threshold for exposure is a lot different.
So interesting. Okay, the same thing with smallpox?
Smallpox
I talk about
is...
that all the time.
I know. Smallpox has really been addressed.
Yeah.
It was interesting that during the smallpox eradication campaigns run by a guy named D.A. Henderson, and they would isolate the case, vaccinate everybody around that case, and stop the spread.
What time in the world are we talking?
What time did that happen?
Like what era? 60s?
No, it was into the 70s, early 70s. And there were different levels of smallpox. You could get a full-blown case or you could get a mild case if you were lucky. But that, rolling them bones was not a good idea. But once you had survived any type of smallpox, you were immune for life. The interesting thing is because it's not smallpox, but vaccinia that you're using as a smallpox vaccine, people who worked in the campaign, the workers now that had contact with the sick people, they were revaccinated every 6 months.
Why?
During the process, because first line workers, people who deal with the sick patient, who have to take care of them when they're ill, they spread the disease.
Oh, interesting.
So you have to take those who are most exposed and make sure that they're not spreading it, because they go from one patient to the next patient to the next patient, and their level of exposure, their threshold of viral exposure is just astronomical compared to somebody who's a casual contact.
Oh my gosh, so much good information.
I hope.
This is fascinating.
It is.
It really is. What's fascinating to me is the fact that we talk about the concept of a virus, right? How a virus's goal is to propagate and spread. It's not to kill. But you think about something like smallpox, and it killed millions and millions of people. It was so lethal. Yeah. So what happens when you have a virus that's so lethal that it kills everyone? The virus dies, right? Until it starts finding hosts again, I guess?
That's not a bad concept, the way you put it, but and it's interesting if you study a disease like smallpox and see how it impacted on the Native American or anybody living in the West, the new world. Now, here's some elements that change the way a disease will work. Number one, how new is it? In other words, have the host animals had any previous exposure to that virus or a virus in that family? There are many different kinds of coronaviruses.
Right.
Apparently, people who have had previous exposure to a different coronavirus may be partially protected. That was part of the information that came out of the studies that have been done. Now, so if you're getting over a coronavirus cold that didn't kill you, you may be well served in terms of protection. On the other hand, the number of animals or host species that have not been protected, which is what happened to the Native American, nobody had ever seen an orthopox virus. And the damage that was done to the population that lived in the New World was incredible. 90+% died.
Oh my God.
And in some areas, when it wasn't...
We're talking the Native American population.
Yeah, we are.
Okay.
But in New England, there were complete tribes that half or more of the tribe would become infected. And of course, pestilence and disease has always been regarded as a sort of a religious or semi-religious event. But the reality is, how many host animals are susceptible, and how bad does the virus behave? Does the agent that causes infection behave? And the more lethal it is, there's an indifference then. It'll go through the whole vulnerable population. But when we even see what happened with later smallpox events in the settlers, who mostly of European descent already had exposure to the plagues of Middle Europe, well, that group would have their survivors. But the issue of the vulnerables didn't happen except when the babies grew to a certain level and you had enough vulnerables reintroduced in the population. So there was a seasonal variation until you had a threshold amount. If you had X number of patients that were resistant or citizens that were resistant or had an immune event and survived it, then the disease itself would dip.
Yeah.
It stayed at a base level, and then when more vulnerables came along, it went back up again. It looks the same for just about any virus you can name, and it's been that way forever. When they said that COVID-19 was a unique event in the history of mankind, it's not true.
I know.
It's just not true.
I know, but they're not giving anybody context or helping anyone understand.
I know, and the irony was, even with the most strict quarantining, and isolation techniques, it never stopped the viral disease. And all you have to do is...
You can't.
No, it won't. It just won't. That's outside of the biological reality you're dealing with.
Yeah. Also not explained. So, you know.
No, nobody was given that info.
No.
But again, you're dealing with an issue that's become confused with politics. It's become decision. If this is the 21st century, we should be allowed at least the right to decide.
Yeah.
But having said that, it's the right to decide when you have the right information.
Absolutely, I think that's
not just I don't want it because I don't want it.
Right.
I won't wear a mask because I don't believe in this.
Right.
It's not the point.
Exactly.
Right. If you know what you're doing and you put yourself at risk by going out with your friends and playing badminton.
But again, as a medical professional, you are for masks and for vaccines. So
there's no question about the value of being vaccinated. There's no question about it. And the more of us that get vaccinated, the better it will be seen to work. And it doesn't matter if it's Pfizer's or Moderna. And there's a bunch of other candidate vaccines that work just as well. They take and they simulate part of the COVID. They are not COVID.
Okay.
They simulate it, and they give, in that simulation, a kick to the immune system. Your immune system is left with then an ability to react when and if you're exposed. And it's likely with this amount of vulnerable population that everybody will have to be prepared for exposure. Everybody.
Yeah.
That's just the way it's going to
Yeah.
be. That's what a virus does.
Yeah. Well, I have some questions from people.
I hope we've covered a lot of that.